Good evening, everyone, and welcome to another information grabbing event, which is Let's Talk Vaccination, which has been presented from AGP Community Project. If you don't know already, we are a church in the local authority of Southwark, Peckham, just to be a bit more precise. And we are very, very happy to run this event again. We're just waiting for more people to come in. We understand that a lot of people are just possibly getting in from work, just having their dinner, and obviously would like to be part of this event. So we'll give maybe about 2 more minutes before we get started. And I believe I'm going to wait for Miss Olatunde to, Mrs. Bola Olatunde to maybe introduce who will be coming and representing from the NHS this evening. I welcome everyone once again. My name is Melvin. I'm one of the volunteers at AGP Community Project, and this evening we'll be again speaking about Let's Talk About Vaccination, which was a very good event last month. It was very informative. But before I get into more introductions, like I said to everyone else, I'm just going to wait 2 more minutes. Some people are probably just getting in from work, taking off their things, probably getting a bite to eat quickly, having a quick drink before they get some information. So you're welcome all, and thank you very much for attending this evening. Fantastic. And just to let everyone know, just for privacy's sakes and just to make sure that everyone is well aware, this Zoom meeting, which is an event for us at AGP Community Project, it's going live on YouTube as we speak now, and it's going to go on the church, well, the Community Project's Facebook as well. It's just a way of us capturing this information to give to our wider audience that maybe not be able to connect with the Zoom. And then obviously some people can refer back to it as well. So I hope everyone's happy with that. So I have it as about 3 minutes past 6 o'clock. I'll probably wait 1 more minute and coming into the Zoom, and I'll wait introduce again, and then I'll possibly wait for Mrs. Bola Olatunde to probably let us know who's speaking from the NHS. I can recognize some faces already that I saw last time. Good evening to you, Julian. I believe Judy as well is there.
Then we should wait another couple of minutes, or would you like to start?
Yeah, I think I'm gonna start now. Good evening once again, everyone. My name is Melvin, and one of the volunteers for AGP Community Project. We're having Let's Talk About Vaccination again this month of March, because the February one was so informative, and it made a lot of people get well informed and make good decisions for themselves and their families. We're a local church in Southwark, in Peckham, just to be precise, and obviously we're very much involved with the community. And I can actually feed back some little let's say, measurements or information gathering that we have done, about 90% of the people that were in the last event have at least taken the vaccine or have at least booked to take the vaccine as well. So it's a very informed thing that is happening for our community, and many people's questions. So I'm just getting some feedback from somewhere. There were many questions were answered, and a lot of people, you know, in particular, I've noted that there was a lady who will remain nameless at this moment in time. Now, she actually got the letter before the event, 6 weeks beforehand, and she was scared because of the different information that was going around, and obviously the wonderful doctors that spoke, like yourself, Julian, were able to debunk some of those scary, let's say, informations that made her not want to take it. And she has now, let's say, she's now gone to take the vaccine. So we thank you for your information. I'm going to hand over to Mrs. Bola Olatunde just to maybe give an introduction to who will be speaking this evening, because I just want it to be very formal in that, and that everyone is correctly addressed. So I'm handing it over to you, Mrs. Olatunde.
Oh, hi. I didn't realise I was speaking. Hi, I'm Bola Olatunde. I work for NHS South East London Clinical Commissioning Group. You've got Julian Walker, who heads up the comms and engagement in Southwark. I'm here to support as well, but you've also got a GP, a clinician from Southwark, who would be able to answer your questions as well. So Julian's going to present and give you a vaccination update and share that with you, including some of the questions that people have already asked us. And by all means, you know, feel free to ask questions this time around as well. And then there would be a GP, Femi, who will be able to respond to some of your clinical questions as well. So I'm going to hand over to Julian Walker.
Thank you, Bola. Yes, as Bola said, I'm Julian and I work with her at the CCG, and we work very, very closely with a number of organisations in the borough. So a few of you, I recognise a couple of names from before, will remember Liz, who came along last time from the public health team. And we also work closely with colleagues in primary care, our GP practices across the borough. And at this point, I'd like to introduce Femi. Femi, would you like to introduce yourself?
Thank you very much, Julian. Good evening, everyone. My name is Femi Oshonoga. I'm a GP in Southwark, and yes, I'm here to have a discussion. So I hope you're going to have an interactive session, so it's not a one-way traffic flow of information.
Brilliant. Thank you, Femi. Yeah, absolutely. Looking to make this as much a discussion as possible. A few of you remember last time we gave a bit of a presentation before opening up to questions. I have a presentation today. It's a bit shorter, which no doubt some of you would be very pleased to hear. And then we can get into questions, which I hope is okay. So I'm just going to share my screen and hope that everybody can see that.
Yeah.
Brilliant. So just a quick overview. As I said last time, there are 3 vaccines approved for use in the UK at the moment. The Pfizer vaccine, the AstraZeneca vaccine, and the Moderna vaccine. We're currently using those first 2 and hope to be able to use the Moderna one later this springtime. Now, where do you get your vaccination? So in Southwark, there are a number of ways in which you can receive your vaccination. So there are hospital sites. In Southwark, there's one at Guy's Hospital, and there's one at the Maudsley site, Maudsley Hospital, sorry, that's at Denmark Hill. There are 3 primary care network sites as well where you can get your vaccination. One in the north of the borough at the Artesian Health Centre, one in the centre of the borough at the Lister Practice, and one in the south of the borough at the Testjail Health Centre. We're also working to open up some community pharmacies so you can get your vaccination there as well, and also roving services to vaccinate those people who can't get out to vaccination centres. Another option there as well are mass vaccination centres. So an example of one of these, which is reasonably close to Southwark, would be the Excel Centre. Now, this is a little bit of headline progress for you. So there's some pretty impressive numbers here. So there have been over 540,000 vaccinations given across the whole of South East London so far. And this is information that was up to 2 days ago, actually. So that number will be even higher now. And in Southwark in particular, so over 90% of old people in care homes have been vaccinated. And in terms of absolute numbers in Southwark, over 71,000 people have had at least their first dose of the vaccine, which is brilliant. We're glad to see such high numbers, and it's due to the hard work of people like Femi and his colleagues in our primary care networks and in the hospitals throughout the borough who've been delivering those vaccinations. Now, I have included this, which looks a little bit scary, I admit, but just to show where people are taking up the vaccine and where people aren't. So we've got a list of the wards over here and a map of the borough here. So essentially in the map of the borough, where the darker the colour is where more people are taking up the vaccine. The offer of a vaccine, and you'll see that in the centre of the borough is a lighter colour to the rest. So I'm really pleased that we're able to come here this evening to the church, not only to talk to you, but also to try and encourage people in the local community to think about having the vaccine after this conversation, and also to share the information that you get tonight with friends and family as last time. So in terms of key messages, what to tell people what the situation is and who's eligible for a vaccine. So at the moment, if you are aged 50 or over, an eligible frontline health or social care worker, a main carer, if you have a learning disability or are clinically extremely vulnerable, you can book yourself in for vaccination. You don't need to wait to be contacted, and you can book yourself in at that link there, or by calling 119, which is a free phone number, and you'll get a pick of different vaccination sites in and around Southwark, such as the one at Guy's Hospital, as I mentioned earlier, and the one at Maudsley Hospital in Denmark Hill. Other people are also eligible. So if you're a carer and you get a carer's allowance, or if you're listed as a carer in your GP records, you're also eligible for a vaccination. And there are also people who are in sort of the moderate risk categories. So if you've been informed that you're in that vulnerable category, you're also eligible for a vaccination, but we would ask that you wait to be contacted by your GP practices for seeking out a vaccination. Now I'm going to stop presenting there because I'm aware that well, we want to talk to you and want to hear from you. So I'm going to stop presenting there and open the floor, hopefully, for any questions, any concerns that people have, or things that they've heard which they'd like to find out more about.
I think that's a great way to possibly start. I hope everyone else is in agreement with this. If there's anyone in the group that has already had the vaccine, maybe you can share how you felt and how you're faring after taking the vaccine. I think that's a place to start. Is anyone? Would anyone like to share their experiences of taking the vaccine if they have already? Oh, okay. Anyone with any questions? Oh, yep, Mommy Elizabeth.
All right. Okay. Hi, everyone.
Hi.
The reason I logged on today, because I was here last time, is just to say that when at the moment now, when you were just doing the presentation, I was looking at the brackets and the age term in terms of percentage. Could it be because the reason why you have a low intake in that age bracket is because they have not been invited? Because last time when you came for, when we had the talk, I was waiting to be invited at that time because my age bracket falls between 50 and over. And I had a lot of inquiries from the people that we support in terms of they thought maybe we do give vaccination. And I said, no, we don't. All we do is we just give the information. And some of them said they have not been invited and things like that. So I just like to find out whether could that be why there is a low intake in that bracket? Because at the moment you're doing 50 plus. So for instance, people that are under 50 may not have been invited. So could that be the reason why there is a low intake in that area? And I'll use this opportunity again to just share and encourage people. That's why I logged on today, just to encourage people that, because I took mine on Tuesday. I took my own on Tuesday, and it was actually a very, very easy process. But when I got there, they were going to give me the AstraZeneca. Yes, I never say that word. AstraZeneca one. And with everything I was hearing and about that particular vaccine, I was somehow scared of it. So when she was going to give it to me, I said, I am not taking that. And she said, well, I said, because of everything that I've heard. And she said to me that the MHA has not given them any kind of information about to stop using it. And she did her best to explain it to me. And in the end, I just came to the same thing that, okay, I'm stepping into an unknown area here. The same way I stepped into an unknown area when I got my children vaccinated when they were little, and that was the time of MMR, MMR Costa. And I got them all vaccinated, the same leap that I took yesterday. But the process for me was so easy. I thought I should share that. The only thing I will advise is that make sure that you stay in bed the following day, because that was the mistake I made. I thought, the day was fine, but eventually my body actually forced me to go to bed the following day, which was yesterday. And again, I forgot to take paracetamol in the beginning. So I would say, make sure you take paracetamol and just spend the following day in bed. And at about 4 o'clock, I felt like I was run over yesterday, to tell you the truth. I felt like I was run over by a bus. But then I took Nurofen at about 8 o'clock last night. And I woke up at 4 o'clock this morning. I felt like I could lift anything that came my way. That's how easy the pain disappeared. So yes, I am telling you from someone that doesn't work with NHS and someone that's had her own vaccination. I haven't recorded myself to send to the team that we're supporting in terms of food. I'll do that later to let them know that, I'm not just talking the talk, I am walking the walk. So that's why I just thought I should put that there.
Thank you very much. Perhaps if I answer the first bit, Femi, about the different percentages of uptake in the borough, and then if you talk about the AstraZeneca, is that okay?
Yeah, that's fine. Thank you.
So in terms of the percentages, it's a good question. What I showed there is the percentage of those people who have been invited, essentially. So everybody over 50 can just simply book themselves in. And they are also, we've actually had a number of, I'm not going to say complaints, but a number of suggestions from people about not contacting them from different sources. So often people will get a message from their GP and from the hospital, because they're both working, well, obviously the same people are in Southwark, so they're looking to contact residents and using the same list. So sometimes people do get 2 invitations, but there may be some people who haven't been invited yet, you're right. But in terms of, I would expect those to mostly be in people who are much closer to being 50 years old, just as those cohorts are newer. But if there are people who are, I don't think there'll be many, if any at all, but if there are people who are in the older age brackets, particularly those in the priority cohorts 1 to 4, who you know and haven't been contacted, haven't been offered a vaccine, please do get in touch with us, and we can look into that and figure out the best way forward for them to help support them with the vaccination. But hopefully the percentages there that I showed, they're not about, it will have the same effect across all boroughs, and what we see in other boroughs and elsewhere in London is that there's a much more sort of uniform uptake and a bit of a higher uptake as well. So it is in Southwark, we're a little bit further behind on uptake, but and some of it may be due to invitations, but probably not that many, is what I would say in a very long-winded way. Sorry. Femi, would you like to answer the point about the AstraZeneca vaccine?
Yes. Okay. Yeah. So there's been a lot of news in the press in the last, I would say, in fact, the last few weeks, but more so in the last 24 to 48 hours, about the safety of AstraZeneca vaccine. And it was on the BBC today about what the WHO says about it. So what we have so far, so across UK and Europe, in the UK, we've given over 11 million doses of AstraZeneca. If you combine that with what has been done in Europe, we've given over 17 million doses of AstraZeneca. And in all of these cases, we've had reported, not linked, there is no link that's been established so far. For some people who have had this immunization, some of them have gone on to develop clots, okay? So people then got very, very anxious. But when we don't have immunization, when we didn't have to give AstraZeneca, at least in the UK, over 160 people a day will have clots for various reasons, for various underlying conditions. So there's a baseline risk in the society that we have of developing all sorts of infection. But it is, the anxiety is quite appreciated, that people are now trying to make a cause and link between the vaccine and the clots that people are experiencing. But so far, from the WHO, they're saying that there is no link, there is no cause and effect between people developing clots and people having the vaccine. MHRA has said the same thing today, okay? And also the European Medicines Agency, I don't know whether people saw that on the news, everybody was waiting for their reports from Amsterdam. And about midday today, they also said there's no link. It is safe for people to have the AstraZeneca vaccine. So another statistic that came out is that if you don't have vaccine and you have corona, even when you are young, when you're under 50, because majority of people under 50, they will survive. But if you are young, you don't take it, you stand a 1 in 1,000 chance of dying from COVID. So if there are 1,000 people in this country who are 48 and they have COVID, at least we'll lose one of them. And that is one too many. We don't want that. And then if they have other risk factors as well, obesity, their ethnicity, they're diabetic, it increases their risk. So that is why it is very, very important. But in people who had the vaccine, they are now saying that your risk of dying, if you're not one in a million. So if you imagine that we're giving 17 million of AstraZeneca, if at all there's any link, if there is none at the moment, only about 37 people have reported adverse effects. If you just work that on a calculator, you can see how small this is. So please, my plea to you would be, the science is not supporting what is happening. There's a lot of hoo-ha that is going on that is driven by politics that we just need to stand back from and try to see how we benefit our people, ourselves. So please, I like the way that Elizabeth has described this. She's gone in there, she had doubts. Mothers have doubts when we gave children MMR, when we gave them polio, when we gave all sorts, but they still took it, and most kids did not get side effects. I will say the same thing. I've had my own vaccination as well, and I had the same experience of feeling very tired the next day. Although it wasn't as bad as being run over by a bus, because I was able to go to work, but I felt very tired myself too. And then after about 24 hours, it got better. So please, that is very, very important for us to note. AstraZeneca is safe. The Pfizer BioNTech that we are giving is also safe as well. So people should please go out there and have their vaccine.
Brilliant. Thank you, Femi. Yes, in terms of side effects, my mum and my wife have both had the AstraZeneca vaccine as well, and they both had very minor side effects, a bit of a sore arm, and my wife had a bit of a fever for 24 hours or so, and was very tired the next day. But it was completely safe, and now both protected, which is fantastic. I've seen a question in the chat from Judy, which asked whether we have the Johnson & Johnson or the Janssen vaccine yet. As far as we're not using those vaccines yet in the UK, and as far as I know, I don't think they've received regulatory approval yet. I think they're being assessed. Is that your understanding, Femi?
Yeah, that's correct. So they've been assessing the states at the moment, so they haven't got that approval yet.
Great. So yeah, the more safe vaccines we can have, the better. But obviously they all have to go through a very, very strict process to make sure that they're safe. And hopefully both of those will prove that, and we'll be able to start using them in the UK.
Yeah, so Johnson & Johnson is still far behind compared to Pfizer and AstraZeneca, because we have used this in a wider population. So we now have data that they will not have for Johnson & Johnson. But all vaccines, the more we can vaccinate the world, not just UK, because if the rest of the world is not vaccinated, we all stand the risk of catching things when we travel abroad. So that is why it's important. It's a global pandemic. So the more vaccines that we have out there, the better.
Sorry, I don't want you to just keep repeating yourself, but in the sense of, can we have more information on, for those that haven't been contacted yet to take the vaccine, how they can go about, booking themselves in if that's an option?
So if I just take that, Julian, so what we are doing now is that we are vaccinating people in risk categories 1 to 9. So if you go by age, the age puts you at risk. The older you are, the higher the risk of you dying from COVID. So that was what formed, that is what helped to form the opinion and stratification of the risk groups. So we've done a lot on groups 1 to 4. We got down to group 9 now, and we are pushing for people. For instance, people will be in group 6 will be less than 50. They will be less than 50, but they might have underlying conditions. They might have badly controlled diabetes, badly controlled asthma. Those ones are being called in. We've also, as Julian said earlier on, we had people initially who had carers allowance being called in, but we now know that whatever you go, once your GP knows that you're registered carer, you're looking for somebody, even when you are not having carers allowance, they will contact you to come and have your vaccine. So we want to try to immunize people as much as possible. So you will be contacted. We are pushing for the 1 to 9 because very soon we'll be asked to start vaccinating people under the age of 50. And we know that the deaths in COVID, 99% of the deaths in COVID is in people over the age of 50. So before we start immunizing people who are younger, we want to make sure at least everybody that is over 50 in the UK has had at least one jab, if not two. So that's where we are at the moment.
Okay. Thank you. I can see a question in the chat, and I believe this was asked in the last event last month, which is what is the difference between the two? Are there any differences, sorry, between the two vaccines? Well, there's 3 vaccines at the moment, but the main 2 that we've been hearing about or know about, which is the Pfizer and the AstraZeneca, is one.
So they are made differently. So the first one was a very innovative way of making vaccine. The first one we had was the Pfizer-BioNTech, which came on stream in early December, then followed by the AstraZeneca early January. So the way that this was produced is to clip. You must have been seeing what looks like a golf ball with many horns on it as the model of the virus. So what they did is to clip part of the protein that is on the virus and try to replicate a lot of this in the lab and test it through various stages, through various clinical trial stages. And from that, they produce the vaccine. So there is no virus, there's no live virus in any of these vaccines. That's number one, that's the commonality that they have. The other one, which is your AstraZeneca, is actually carried by a dead adenovirus that they put this into, and then through that, they stimulated immune responses, and that is how they've been able to give this to us. So what I've had before, people saying, oh, can it cause infertility? Can it do this? There is nothing live in these vaccines to cause infertility. They don't do that for that reason. Yes, so they're different in the way that they've been made, but the safety profile is the same.
Okay, thank you, Dr. Femi. I can see another question here from, I'm not sure of the name, so I'm just going to read out the question, which says, why is it that we have been given, I'm sure that they're alluding to the vaccines, one that has been now rejected in Europe. I'm not sure how much there's truth in that, but yeah, that's one of the questions.
Yes, that's the AstraZeneca. That's what we've just been talking about. So okay. You guys, you've left us. You've Brexit. You've taken your vaccine first. So people are angry. I mean, you can see between Boris Johnson, the exchanges today. If you go into the news between Boris Johnson and the president of the European Union, I've forgotten her name now. So there's a political drive in that we started early. We started way before Europe started vaccinating our people in the UK, because the UK government invested, they took a risk by investing in these vaccines before they were even manufactured. When it was getting to the final stage, they were already having discussion with AstraZeneca, with Pfizer, can we have some of this? Because they were desperate. And it sped up for the UK. So we were way ahead of them in that we were able to procure, to buy the vaccine faster than Europe. Some of the vaccine that was brought into this country, the Pfizer-Zeneca, they were actually produced in Europe. I don't know whether you are listening to the news when they were going to put a blockade between the Republic of Ireland and Northern Ireland. That was the politics behind it, because this is being produced in Europe, but it's going to be given to people who have chosen to leave Europe. And then they couldn't stop that for contractual reasons. So that is why we started earlier than the rest of Europe. So because of that, there's been a lot of bad mouthing of the vaccine, which is the AstraZeneca, through political means more than anything else. If you read all the reports, if you go to the European Medicines Agency, you can Google it and check their summaries all there about the safety of this vaccine. While the presidents of France and the one in Germany, how they started all this, they just made it very difficult, and they've given false information to people that have made them very anxious. But as I said earlier on, there has been some incidents. So we're going to give honest opinion here and honest information. So I'm not a spin doctor or anything like that. So there has been some incidents of thrombosis, that is clots in the blood in some people who have had this vaccine, and they're trying to figure out, is there a link is there a cause and effect between AstraZeneca and people who have been unwell? That has not been established by 3 different organizations: World Health Organization, Medicine and Health Products Regulatory Agency that we have in the UK, as well as today, the one that is serving the whole of Europe, European Medicines Agency. This afternoon, I said that it is safe to use. So I just want to emphasize that. So if we are repeating ourselves, but it's very, very important that people get the truth about what's going on.
Thank you.
Thank you. I would just add to that to say, in terms of the in answer to that, why are we been giving it when some European countries have paused it, is because everything we have shows the vaccine to be safe and effective at preventing COVID. And as Femi said, with all the different regulatory bodies that are looking into it at the moment, it continues to be shown to be safe and to be giving people really good protection from the virus. And so that's why we're still continuing to use it in the UK and in Southwark. I can see another question there in the chat, which is what's the gap between the first vaccine and the second one?
So the gap at the moment is between 10 to 12 weeks. That is what the government has recommended so that we can give the first dose to as many people as possible. So we have a wider coverage. And again, that is a decision that seems to have yielded a lot of good results. If you look at the number of deaths and hospital admissions over the last few weeks in the UK.
Is there any more questions from anyone? I have one in terms of the I guess it's not too much to do with the vaccine, but are you able to debunk some information regarding testing? Because in schools, you know, they're doing a lot of the lateral flow testing, and obviously there's another procedure of testing as well. And some, you know, I guess some of the notions or the narrative that have been poured out is that the lateral flow testing isn't, it's not that accurate, or it's not. Can you shed some light on that, please?
Yes. So the lateral flow testing is not as accurate, you're right, as the PCR testing that we do when people come to surgery. But the lateral flow is readily available. So the objective of the lateral flow is for massive screening. Unlike when you have somebody who's sick and you want to make a diagnosis. Yeah. So it's easy because when you have a pandemic, when you have a crisis, you want to get to as many people as possible. So that is why you can do the lateral flow in the confines of your own home. So that's why people who are not trained are able to do this and do it quickly. You can get almost instantaneous results, but it's not as reliable as the other ones. So if people then become positive and they're unwell, they can then get them. Number one, it helps to alert the whole community, the whole household, that this person might be unwell. You guys need to shield now so you don't spread the infection in the community. So that is the purpose of this. That's the objective. Yeah.
Okay.
And I've had people before, sorry, to cut me. So people have told me before they are shoving things into our children's nose and throat and stuff. It's not a shove. It's just a simple, like cotton wool that we use. Nobody is damaging any child's noses or throat. I just want to put that in there because I've been to many of these discussions and people have come up with things that they are concerned about.
There's another question about the Johnson & Johnson vaccine, Ferry. It says, what can you tell us about the Johnson & Johnson?
The Johnson & Johnson, to be honest, I don't know much about that now because it doesn't have an approval yet. But as soon as it has approval and the literature is shared, what is called a summary of products, then one will know more about it. But what I can tell you about it is that they are saying that with the Johnson & Johnson, that hopefully it might just be one injection that you get rather than having 2 doses to achieve your maximum benefit from it. And don't forget that all these companies, they're in competition. So you want to bring out the product that is most convenient for people, and that is where Johnson & Johnson is going with this. But everybody is waiting eagerly for the Federal Drugs Agency in America to give them some license for people to use. But I do not have more information about this at this stage. But if it is licensed, definitely one will look more into it.
I think I saw a second part to that question, which asked whether it's better to wait for the Johnson & Johnson vaccine. I certainly know my answer to that one, but Femi, perhaps you might put it better than me.
Okay, so I will advise you not to wait for Johnson & Johnson. There is no benefit in doing that. If you're waiting and then you catch COVID, even if people don't die from COVID, there's something, the concept now called long COVID, in which your body will be so damaged that it takes you a long time for you to recover from it. So the quality of life will be impaired if it's not there. So I will not recommend that people wait for Johnson & Johnson. And as I said, we have more information now for Pfizer and BioNTech, as well as AstraZeneca. Millions of people have used this now, so we have a lot of data. So in that way, they are ahead of Johnson & Johnson. So please don't wait for Johnson & Johnson. When we call you, please get the jab.
Brilliant, thank you. Yes, absolutely. That's a very good way of putting it. I would add as well that sort of obviously well, as Femi said, the longer that you don't have the vaccine, the less protection you have against COVID, and that isn't only sort of a risk to you, as Femi outlined, but also potentially to your community and your family and friends as well, as well, you might not even have any symptoms and might not know that you have it. So it's better to get the vaccine earlier when you can.
There's another question, Femi and Julian, as says, I took my vaccination in faith. I was given Pfizer. The fair had 15 minutes of waiting. Very scary. Are we still going to wait for 15 minutes for the second dose?
Okay. So the 15-minute wait, yes, you would. That is one of the standard operating procedures. And the reason for that is that if you remember when Pfizer came out, the Pfizer BioNTech, in the UK, we had two people who had anaphylactic reaction. They had abnormal reaction, severe allergic reaction to the vaccine. So that is what formed the opinion as to we need to make this safe. I can tell you with confidence, the UK is one of the countries that takes safety of medicine very, very seriously. So that is why they said that when you've had your Pfizer vaccine, you should stay in the clinic for at least about 15 minutes. That will give us confidence that because if anything happens to you, we can rally around and take care of you. That is the rationale for that. And that will not be lost. Even when I had my second dose, I still have to wait for 15 minutes. Like anybody else. So please, it's the safety reason. It's for our own good. That is why that is. You might be sorry, it might be a bit inconveniencing, but I think it's an inconvenience that is worthwhile.
In your experience, Femi, would you say that you've had to help many people during that 15-minute period?
No, we've given over 17,000 vaccinations. We've not had to help anybody. The only person that I helped was somebody who fell. They missed their step on the curb and they dropped onto the floor and banged their bum on the floor. That's the only person. But nobody's had abnormal reaction in our own vaccination center. And even if you look across the UK, because this is new, if there's anything that is untoward, apart from our headaches or and tiredness that happens, it will be reported nationally because we are all in surveillance mode, because a new product, national guidelines says you have to report. So there's nothing that's been reported in our center or anyone that I know about in the whole of the UK.
I think is there a difference in the question in the chat is saying, is there a difference in the second dose? Is it stronger?
No, the second dose is not stronger. So in the UK at the moment, we're not doing, so if you have AstraZeneca as your first dose, the second dose will also be AstraZeneca. If you have Pfizer, the second dose will be Pfizer. And the rationale for that is that they want to give you a maximum antibody response. So the soldiers in your body that helps to fight infection, you want to generate a lot of them as much as possible. And when they were doing the research, so initially they'll give your first dose to the people who are involved in clinical trial, and they measured the amount of antibody response in their blood. It got to a second level, and someone then said, why don't we try and give some people a second dose? And that's exactly what they did. And they realized that if by giving 2 shots, you will even have higher response. So why don't we aim to optimize the response that people can have? And that is what that helped to form that opinion and decision. Yes, so it's better for you to have your 2 shots when you have been called this, so that you can get the maximum benefit from the vaccine.
I'm jumping the gun a little bit here because we spoke about children having vaccines when they're born. Is the idea to get to a stage where you know, because apparently, you know, the younger generation children are carry you know, the infection much more rampantly than others. So is the idea that they will have the vaccination at birth, or what do you think is going to happen? Will they start rolling it out in terms of what they do sometimes at school with the, for example, tuberculosis ones and whatnot? Is that what will happen?
I think that's a very, very good question. But the science doesn't support that at the moment because we haven't got to that stage. Because the vaccine has only been tested in people up to the age of about 16, because of Pfizer and AstraZeneca up to the age of 18. So we do not have that information in children. So, and the deaths that we are having, as I said earlier on, is actually in the older age group. Right. So this is a condition that's not going to go away. So just as we've had flu for over 100 years, I think I'm not being pessimistic, it's just a sign that this is probably going to be something that becomes endemic in our society. It lives with us. Yeah. Our body fights it fights us, and it keeps mutating. As you see, they have South African variant, Brazilian variant. It will be wanting to survive as we're trying to chase it as well. So I don't think we've got to that stage in which we'll be thinking about vaccinating children as part of the child immunization program. There is no science behind that. That is still, so we don't know. And science, we don't know.
Yeah, absolutely. I'd add to that there is a study in the UK at the moment looking at how effective it would be. So they've recruited some volunteer children to be part of that study to see what effect the vaccine has and if it would be effective giving the vaccine to children. But there are no plans currently to roll it out, as Femi said, below sort of the age of 16 at all. But it may well be part of the plan in the future, but it's not at the moment. There isn't, as Femi said, there isn't the science to support it yet.
I'm not sure. I think this is in relation to the question that I read out before. It says, what would happen if you don't take any at the long run? So
what will happen if you don't take a vaccine?
Yeah, I think that's what what would happen if you don't take any at the long run? So maybe they're alluding to taking the second dose.
So if you don't take it at all, you're putting yourself at risk. You're putting your family at risk. You're putting members of your community, those that are very, very dear to you, you're putting them at risk. So let us think about it that way, that it's not just me, it's what can happen to me and the impact on the people who depend on me and my loved ones. So that's the first thing. Then what will happen to the people in my community? Because we need to have responsibility to ourselves and responsibility to others as well. Okay, so I think that's what I think we should think about. But if people have anxiety about this, I want to appreciate that. So we cannot just rubbish people's anxiety, but let them bring it to the fore so we can talk about it, back it up with the evidence, the science behind what we are doing. So it's very, very important. So I'll plead with you, if you are not thinking about having your vaccine, think about yourself, think about your family, think about your community. You can then make a choice.
Yeah, that's a very good way of putting it. I heard somebody else say the other day that there are only two ways of there's only one way of protecting yourself from COVID-19, and that is to have antibodies in your system. And there are only two ways to get antibodies against COVID-19, and one is through the vaccine, which is safe and predictable and doesn't offer any risk to the community and those around you, or there is actually getting COVID-19 itself, which in its worst case can be fatal and present a risk to others in the community. So yeah, we would always advocate getting the vaccine. I've seen a couple of other.
A couple more questions. Yeah. I think someone's pointing out that a lady went for the second and was feeling dizzy and felt it badly. So I don't know whether Femi wants to sort of comment on that.
Yeah, so with any vaccination that you have, so I'll just run through common things that you might get, including COVID vaccination. So you might have soreness at the site of vaccination. You might have headache. You might feel faint. Some people, even before you touch them with the needle, they might feel faint because some people just don't like needles, okay? So nothing to do with COVID, it's just that the fear of needle. And then some people genuinely, when they have the vaccines, they can make you feel a bit queasy. And if that happens, they tell you to sit somewhere, they might ask you to lie down, some people give them a cup of water, and they're fine. Okay, so that is one of the common things that you might get, apart from the fatigue that we talked about earlier. Well, most effects of the vaccines will last about 24 to 48
hours. There was another one which says, I know you said we should not wait so we don't get infected with COVID. My question is, if I insist on waiting until the very last minute to get my vaccine, is it wrong? Or is it a wrong idea to wait?
So it's all depends on what we call the last minute. Mm-hmm. So today might be the last minute because tomorrow you might be exposed to the virus. And your last minute might be a month from now. So it's very, very difficult to determine what your last minute is. So my advice would be, try to take today as your last minute and try to get yourself vaccinated as soon as possible. There's no point taking a risk, because if you then become very unwell, it's regrettable.
There's another one, Femi, about, I know you probably touched on it already, but are there any underlying complications that could occur after taking the vaccination?
Right, so till today, up to this minute, there isn't anything that is serious that has been associated, that's been linked to the vaccines. But this is early days. This is early days. So the information we are collecting over this vaccine will be collected over many years. We only started vaccinating in December, but it's just the sheer volume that we have used that is giving us confidence. So this is based. So when we talk about possible effects, we are talking of experience that we have gathered over a 4-5 month period of these vaccines. But what is just giving us the confidence is the number that is being used, okay? So up till today, apart from the things I've mentioned to you, we do not have any evidence of a long-term, and in the clinical trials as well, okay, we don't have any evidence of any long-term complications from this.
We have a question from Mrs. Elizabeth Akinsayo.
Oh, yeah, sorry. Hi, it's not actually a question. It's regarding the the invitation and the take. I just want to find out, how are you guys getting hold of people, for instance, that is without recourse to public fund, you know, people that may not be out and about? And secondly, do you have a kind of a leaflet or something? Because sometimes people's mobile phone changes. My own invitation came by text. So if all you guys are relying on is the information that is being held by the GP, then there is the possibility that some of it will be going. It's not the fact that they don't want to take it, but the fact that the information is not getting through to them. So is there some kind of a leaflet that we can have so that we can share around? You know, because some people are just, they're scared of coming into a platform as this. You know, is there anything in place that you have, you know, put in place to be able to ensure that we can get as many people, the information to as many people as possible?
So, Julian, if you want to take
Yes,
that.
absolutely. Thank you. So in short, yes, we do have a leaflet, and I'm very happy to share it with you. And yeah, if I'll pop my email into the conversation afterwards, and if you send me a message, I can arrange to get some printed and sent across for you to distribute if you'd like. And we also have other ways. So people aren't just contacted by text message. We do try to call and also send letters too. So that isn't the only way. And as I've said, people don't always have to wait to be contacted either. So if they do fall into a priority group, they can either call 119, and that's a free phone number, and book in for a vaccination that way. Or I'll pop the link into the chat as well for booking vaccination online, and I'll also put the link into some information which I'll share afterwards, the presentation I've got there, so people can either call up or book online as well. Yeah, Femi, did you want to add anything?
Yes, so that's fine, Julian. In terms of the people who are hard to reach, so people who have immigration problem, they haven't sorted out their papers, please know that they can register. This is pandemic. There's nothing, we are not immigration people, and the government will recognize this. You can go to any GP and register. We will not be asking for passport, or your status is not relevant to us as healthcare providers. So please, because a lot of people that I meet is fear of being caught, or we are going to report them to immigration. Doctors don't do that. So please be clear about that. And then, because if you don't register with the GP, you are not on the national database. Because all these figures I'm putting to you is through the fact that we have a well-established data system. So please tell whoever you know that if they don't, if their immigration status this does not depend on it, they can please go to a GP and register, and I can give that guarantee sort of that. In fact, nationally, it's a national thing. We are not asking people. That's very, very important.
Yeah, absolutely. I 100% agree with that. We are not asking, we're not sharing that information anywhere. And I believe there is also the opportunity for people to use a temporary registration to be vaccinated as well. Is that right, Femi?
Yes. Yeah, so you just come in, say you want to register with the GP will register you. Okay. And then that way you can be treated. So there's something on the chat.
Yeah, there's one more question.
So they've asked, they do ask you of any allergy, or if you take any of the tablets on the wall, for example, aspirins. Sometimes you take them without knowing. So what would happen? So presumably if you'd taken an aspirin or weren't sure, I've forgotten to mention it, Femi, and had the vaccine.
Yeah. So there is no drug that you just take your drugs as usual. Why we do ask you about the medications that you are taking, an allergic reaction, is just for the reason giving you earlier, people who had severe reaction to the vaccine at the start of the program. So one of the things that was then set up by the government is that when you go to that vaccination center, somebody will come with you with a piece of paper and they'll be asking you questions. And a lot of that will revolve around your medication, allergy. So that we need to, is trying to quantify the risk for individual so that you know that if you need to immunize this person, you're going to vaccinate them, what risk is there? That's what that is about. So please don't stop your medication, take your medication. And if you're allergic to anything, just tell the doctor or nurse who will be interviewing you at the center, and then we'll know what to do.
They've come back on that one, Femi, and said, but sometimes you don't know if you have had it unknowingly. What would you say in that example?
That is why we have the 15-minute wait. So the 15-minute wait is considered to be safe. So even if you don't know whether you've had allergic reaction before, some of us might not have our whole medical records or might have forgotten. That is why the safety net of 15 minutes has been designed into the program so that to capture it when we don't know. So that's the importance of that.
Away from the side effects of the vaccine, I believe in the last Let's Talk About Vaccination, one of your representatives said that, and I believe this narrative to be quite true, that people from the BAM community don't really offer themselves in terms of research for things like the vaccine. And it made me ponder, it made me think, why is it that people from the same background as me, we don't offer ourselves up for research and stuff? How, if one did want to, what can you do? How do you offer yourself up for, because apparently the statistics aren't that high for our community or people from the BAM community in terms of research for vaccinations and other purposes for health?
Well, there's a huge mistrust in Black and ethnic minority communities based on what has happened before. There's been some dreadful things that pharmacological companies have done to Black people. If you remember what happened in America years ago, in which people were being given medication and they were testing it inappropriately for years without them knowing. We had something similar in northern Nigeria. So pharmacological companies have sometimes behaved irresponsibly. And when it has been targeted against ethnic minority people, now you see why people don't have the trust. Well, we have moved from that. Something has happened in the past, correction is being made, and people will need to just learn to trust the system again. And that's why we're having sessions like this. So things have been, checks and balances have been put in place. If I just focus on COVID vaccine, Pfizer alone was tested in about 6 different countries, including Brazil, that has a very high Black population, about the second highest in the world, and then in South Africa as well. So we use this in all sorts of races, whether white, Black, Hispanic, Asian. So in terms of COVID vaccine, I can tell you to a certain degree that that's been taken care of. But it's what has happened in the past that has made people to be wary of the system. And we need to try to encourage people. And that's why we're having this. That is why all of us should be ambassadors in trying to dispel some of these rumors. So Black people don't offer themselves for research, for transplant, for all sorts, because of the deep mistrust that we have of society. But we need to start moving away from that, because that is how you can see what happened in the first wave. A lot of people who died, unfortunately, are from the Black and ethnic minority. If you have a look at BBC and they display those obituaries, you can see the faces there. So that is why we need to move. Please, I will encourage you. Let's be open about this. Things have been done badly in the past, but there's a new chapter that is open now that we can work with.
And how do you become, like you said, to further the science and the research, how do you become a volunteer in being part of the research? Because that was one of the points that was made by one of your colleagues, that, yeah, we understand there is a mistrust, but what if somebody wants to start to trust, but wants to be part of the research to help? Are you understanding what I'm saying?
So I'll just put it out there. I do a lot of, I'm involved in primary care research, like some other GPs as well. So my practice will be approached for various reasons. So we are involved in COVID research as well, recruiting for the national pool. So the National Institute of Health Research has primary GPs in South London, in Southwark. A lot of us are involved in this. So if you go to your GP's website or you ask them, you can ask, look, are you guys involved in research or not? And they can tell you that we are not involved, but if you want to be enrolled, there are ways that we can get you enrolled in research by going to so and so place.
Okay.
All right. So yeah, so there's opportunity in primary care. And then in secondary care as well, when people go to the hospital, they will offer them that we are doing research, do you want to be part of it? Okay. But it's got to be from your free will. Nothing is compelling. I should not affect your level of care, even if you say no.
Thank you very much.
I would quickly add that I can put a little bit of information into the slides as well, to share if that would be helpful.
Yeah, that would definitely. I think there's one more question in regards to eating and drinking when taking the vaccines.
Right. So you have to live and be merry. Vaccine, they shouldn't disturb this. I'm joking. So what's the question? So eating and drinking. Can you drink or can you eat?
Yeah.
Of course, just live life like normal. The vaccine does not stop you from doing what you normally do, your way of life. It shouldn't stop you from doing whatever you do.
Sorry, I think the question is, what would you advise before going to take the vaccine and after? Should they eat or drink before or straight after?
You can eat or drink, as I say, you can just live as you normally do. There's nothing that says that you have to not to eat or you have to fast. You can eat and drink before the vaccine, and you can eat and drink after the vaccine. So just live life like you normally do. There's no restriction on food intake or fluid intake, pre or post vaccination.
We're coming past 7 o'clock now, so I don't know whether there are more questions or what would you like to do?
I think there's one more question, and then I'll hand it over to for a close from the shepherd in charge of CCC Amazing Grace Parish. The last question is for the doctors. When will the invite come for us, and how for the middle-aged and younger ones?
So the invite, so for people under 50, we intend to start vaccinating people and calling them very soon. But as you might have heard in the news yesterday, we had some delay in delivery of vaccines. So we are bound to have delay for at least about 2 to 3 weeks. So the details of that is being fleshed out now, but there has been some delayed production of some of the vaccines coming from India, and that's not going to be on our shores. So we just have to plan for that. But the key thing is I want to try and get our people in the over 50s and with risk immunized. And shortly, we will be getting invitation from your GP within the next few weeks of when you'll be able to start having your vaccines again. So it should be soon.
Just to add to that, we, along with in terms of the national timetables, Southwark is aligned to that. So we'd be looking to offer everybody who's over 18 their vaccine by the end of July. And one of the good things so far has been, as we've been moving down, so when we've moved from age group to age group, people are able to book themselves in. So when it's likely that when we move down to, say, 40 people who are over 45, that they would be able to book online through the website or ring 119, and they wouldn't have to wait to be contacted if they didn't want to be.
Thank you very much. And I'll hand over to Shepherd in Charge, Prophet John Martins, just to close with this event.
Wow. Thank you very much. My name is Prophet John Martins, and I am the sitting pastor of Celestial Church of Christ, Amazing Grace Parish, London. On behalf of my able AGP community team who are taking their time to put all this together. My special thanks go to Bola Olatunde and for all efforts that you made in connecting us with most of the GPs around Sodok. I believe more than 6 or 7, if I may be precise. It's a job well done. And for those of us who have been impacted, who has been online, and who will still be listening to every interactive sections of today, I'm believing that we will not die and it shall be well with us. And the community will continue to grow, was stronger. What a job well done. Walker, thank you very much. Femi Ashinoga, you've done a fantastic job. And also of other doctors. I believe that we are very impacted and the message is quite informative. And all we can wish the SODOC is the best in all your endeavors. Thank you very much.
Thank you.
Thank you.
Right, I think we can end there. Thank you everyone for taking out your time once again, and hopefully, you know, if there's a need for another one, like I said at the beginning, this is going live on YouTube as we speak. It's going to be there on the church's YouTube channel, and yes, I just hope everyone's got now an informed decision. Please share with your friends and family, just so that you know their questions and their thoughts can be let's say answered from this event. And once again, thank you all for taking out your time from your busy schedules to make this event a very informative one. Thank you. And I'm going to end it there. Everyone, good evening. Goodbye.
Thank you.
Thank you.